Hi, everybody, and welcome back to the IBS Freedom Podcast. Today, Amy and I are going to be covering hydrogen sulfide, H2S, baby. This is one of the biggies in the SIBO world, especially now. Dare I say, it's kind of the up-and-coming topic in a lot of SIBO discussions, and I think it's very worthy of our attention and conversation. So, hello, my dear. Let's talk hydrogen sulfide. Can I kick it off to you first and tell the good people at home a little bit about hydrogen sulfide, and then we'll get to picking this apart a bit because there's a lot to discuss.
Right. Yeah, I think, there's always been three subtypes of SIBO for a while. The hydrogen, the methane gas, and hydrogen sulfide has always been tricky because it's always this like black hole of, okay, if you have SIBO symptoms and you're flatlined, it's hydrogen sulfide. It's kind of been like a scapegoat almost towards like any symptom that's kind of unexplainable, and you get, in a flatline. It's hard to know if that actually was hydrogen sulfide without the newer testing that we have now. So I think it's going to be really, really interesting how we interpret it and what hydrogen sulfide SIBO exactly looks like. It's going to be a much clearer picture now that we have better testing that actually looks at hydrogen sulfide gas. And I know, like, for me personally, I feel like I'm still like gathering data points with the new testing. And it's interesting talking to you about like your observation with the hydrogen sulfide breath test with the Trio Smart that's been out as of late, sort of what you've seen with it. But yeah, it's been sort of a weirder gas just because there hasn't been concrete data on it. It's always been speculative. Yeah. And, shooting a little bit more in the dark. And now that we can kind of see what the testing's showing, and I actually think like we can talk about other things too, like some of the stool testing that's starting to look at like hydrogen sulfide production. And you could look at certain bugs that contribute to it. But I like that some of the testing are actually like looking at, the level of hydrogen sulfide production based on your microbiome, what that looks like. But yeah, it's been really fun hearing your take on sort of what you've seen with the testing so far and kind of comparing it to what I've seen. But I think that the hydrogen sulfide games, potentially it'll be interesting if this changes a ton or not. Having the testing outside of being more affirmative and clear on this is SIBO versus maybe a large intestine hydrogen sulfide issue. So yeah, that's sort of, I guess, where I'd start. I feel like I was all over the place, but I don't know. It's an interesting area, and I think we're gonna get more clear data points on what exactly or how prevalent sulfide SIBO is, hydrogen sulfide SIBO is, now that we have some more tools that can help us evaluate it better.
Yeah. And I'll be curious too, because I will say I've been using Trio Smart since it came out, which I think it's probably like September or maybe October of 2020 was when it came out in the States. So I've been using it for probably 6 or 7 months at this point. And it's been helpful. And they have, it's a great company, good customer support. My one hesitancy with it right now, and the thing that I think is going to make hydrogen sulfide way more controversial and way more confusing.
Yeah.
It's almost like things are going to get worse before they get better. And I think that's where we're at with hydrogen sulfide. Like, hydrogen sulfide was this like mystery question mark, maybe sort of a thing. And now we kind of have this illusion of clarity, and maybe we have more clarity, but there's also some confusion with the new testing. So I feel like there's actually going to be more of a lack of clarity for a little while until we really get an understanding of how to interpret these tests. My biggest beef right now is that I'm seeing a lot of clinicians tell their patients that they have hydrogen sulfide SIBO when in actuality they don't, based on the new testing. And I did a whole YouTube video on this on my channel, but basically any elevated hydrogen sulfide on the test, no matter where the peak is, no matter where anything is, per the lab, last I knew when I reached out to them, the company TrioSmart is telling clinicians that you interpret that as a positive H2S SIBO case. I disagree. And I know it's like really rude and arrogant sounding that I'm disagreeing with the lab that actually made the damn test. But the thing is, like, literally the entire purpose of doing a SIBO breath test is to identify the location and differentiate between small intestinal issues and gas production versus colon.
Right.
That's the whole point. Otherwise, we would do stool testing and we would just look at stool testing and be done with it, which is far easier to do, in my opinion, and more appealing to do. But no, we have this breath test where you're hoping to see a distinct pattern of a spike in gas production that meets the criteria and passes a threshold. If you're using lactulose, probably that needs to be before the 60-minute mark. If you're using glucose, probably before the 90-minute mark. And maybe there's a little bit of question mark and gray area in between. But like the whole point is that we can say, yeah, this is small intestinal overgrowth if the peak happens in the first 60 to 90 minutes of the test. If it happens at any other point afterwards, or if it's a constant elevated to baseline in that it's elevated throughout the test, we cannot differentiate and say, yeah, that's clearly in the small intestine, because we have nothing that's telling us that it's specific to the small intestine. It could be small intestine, or it could be colon, or it could be mouth, or it could be esophagus, or it could be God knows where. So what I'm seeing a lot on TrioSmart is I'm seeing a ton of people who have elevated hydrogen sulfide at baseline. Right. And then that elevated baseline persists through the duration of the test. I'm also seeing a moderate amount of people who have like a subclinical amount, like maybe their hydrogen sulfide is at like 1 or 2, and then maybe it'll peak up to like 4 in the range of like the small bowel. And then it raises a question mark of like, okay, maybe you have a little bit of small bowel overgrowth, but it's not enough to meet like diagnostic criteria, because I think it has to surpass 5 parts per million of arise. But what I've seen a lot from my testing is I've seen only a couple of people where I've said, yeah, that's definitely hydrogen sulfide SIBO. And I've seen a lot of people where I say, I don't think this really tells us that you have SIBO necessarily, but I would bet solid money that you have hydrogen sulfide overproduction somewhere in your GI tract. And either way, we're going to try to work on that in some way, shape, or form. So that's what I would say is that I really am now thinking that hydrogen sulfide SIBO is far less common than we were told for a long time. And I think that it's going to get way, way overdiagnosed for a while, because again, like the interpretation that the way to interpret the test that's being taught to clinicians, I think is incorrect. So I think at least for a period of time, maybe a couple of years, we're going to get a lot of people who think they have hydrogen sulfide overgrowth when in actuality they don't in the small bowel. And it might send people down a rabbit hole that they don't necessarily need to go down quite that hardcore. But I'm glad that we have the test. I think that it's a great tool if you use it appropriately, but it can be a little bit dangerous and send people down a rabbit hole if you're not using it appropriately. So this is what it is.
Yeah. Yeah. And I think the sad thing too is, if you have a practitioner that's not necessarily specialized in SIBO, that's reading some of these tests, again, I could see why they might be like, oh, this is hydrogen sulfide. Like, I've heard about this gas, but like we haven't had a marker for it before, and could lead you down that path. So again, I think you're dead on. I think we need to get more data around it. And it's a little scary to think that, interpretation and how some of the breath testings used these days as well, like how it can be so definitive, like how people can use it as the end all be all too, where there can be, like what you said, some false, maybe again, there's bacteria from the mouth, which I know you sent me an article on more recently that could affect breath testing. Like there are different variables that you want to rule out, and having someone that can interpret results well, I think is so key. And I know you had sent me that discussion we talked about in the last podcast we just recorded about your patient that you had that had a hydrogen sulfide test misread, like that the practitioner misread it and sent them down this wild goose chase to eliminate all sulfur foods, but yet they were on glutathione. Like that, I could see that spiraling potentially, which wouldn't be good.
I feel like I need to like cope for a second here and like regain my composure, because again, it's always kind of been like, it's been this wild west question mark kind of a thing for so long,
right,
in the SIBO world. And also, like, let's face it, SIBO is kind of a hot topic these days. It's really like, SIBO is the new candida.
Yeah.
Right. And it has been for a couple years now, 5-6-ish years. And I think that oftentimes people will see the symptoms of SIBO and they'd be like, oh, I have SIBO. And they'll do a breath test and the breath test comes back normal or negative. And then hydrogen sulfide was always like this scapegoat way for them to say, oh, but I could still have SIBO.
Right.
Because there's this other gas. And it's like, but maybe you don't actually have SIBO.
Right.
I mean, like, maybe you do, but maybe you don't. And I think there probably are people who have not had SIBO, gotten the testing, but had that ability to say, oh, but there's one that's not being tested for, therefore
right.
I'm still going to do the restricted eating and I'm still going to obliterate with the antimicrobials. So yeah, it'll be interesting to see how this unfolds, but I'm kind of anticipating a little bit of a shitstorm for a while we're kind of getting used to the idea of having a test available for this to begin with. And we're getting the hang of that. The other thing too that I will say, and again, this is not to throw shade on the company or Dr. Pimentel, like I have a great deal of respect for both. But the other thing too is that as we learn more about hydrogen sulfide SIBO, I would wager that the vast majority of the research is going to be from that group at Cedars-Sinai, and they're going to be using this lab test and that interpretation, and they might come out. I'm anticipating that they're going to come out with studies in the next couple years that are going to say, oh, some huge percent of people with IBS have hydrogen sulfide SIBO.
Yeah.
When in actuality, it might be that they are interpreting the test in this way to give false positives and they're over-diagnosing it. So I actually think that in the next couple of years, we're going to get a lot of research that says that hydrogen sulfide SIBO is crazy common. And it's been like this big missing link.
Yeah.
And I don't, at this point, seeing the testing that I've run on patients so far, I don't think that that's necessarily true. I think that it's there and it's worthy that we test for it and be thorough. But I don't think it's like I don't think it's the most common form of SIBO yet from what I've seen. And I kind of anticipate that in individual clinics and in research studies, we're going to be overdiagnosing this and blowing it kind of out of proportion for a while until we really kind of rein it back in and figure out how to interpret this test appropriately. So keep that in mind too. I'm kind of cringing at the thought of the research that's going to come out of this, but we'll see.
Yeah, there's like this wave of excitement now that this test is out, and it can get like, I don't know, I don't love the term, but like gun happy. I hate that term, but like, I don't know what else, like trigger happy. Trigger happy with like, oh, we're gun happy, trigger happy with with diagnosing hydrogen sulfide based on that testing. Yeah, that's nerve-wracking to think about. And we'll see. I think, it's interesting because, I mean, I mentioned this in the past, but like most of let's talk about symptoms first.
Okay.
So typically, again, like from a hydrogen sulfide standpoint, what are you typically seeing symptom-wise?
Well, and this is something that I think is still a little bit fuzzy too, right?
Yeah,
like,
right.
Historically, and per Dr. Pimentel's lectures that I've heard, they've been saying for a while that this type will often present with more of a diarrhea or a mixed IBS type, right?
Yeah.
So like constipation is less typical. But it wasn't that long ago, maybe a month or two ago, I saw an article pop up on my Google Scholar alert saying that hydrogen sulfide was associated with constipation.
Yeah.
So I don't know. But theoretically, per the experts that I've heard talk about it, usually people are assuming that it's more of a diarrhea or a mixed presentation.
Right.
For IBS. I think, bloating, abdominal pain, abdominal distension, all of that can go hand in hand with that. If it's hydrogen sulfide SIBO, in particular, I would think of more like bloating after eating, particularly more like SIBO triggery foods. Seems like there's more far-reaching effects for this gas in particular.
Yeah.
I think just having SIBO will make you, and like having dysbiosis will make you have more inflammation and rev up your immune system response and create inflammation. But the hydrogen sulfide seems to be particularly nasty in driving inflammatory processes, really putting a lot of tax on your mitochondria.
Yeah.
And zapping you of your B12. So a lot more like fatigue and brain fog, I think, is more common with this group.
Yeah.
And also like widespread body pains, like fibro type pain, even like bladder pain or irritation, like interstitial cystitis kind of stuff. And even like nerve pain and neuropathy can be a big thing with this crowd too. So those tend to be the biggies. I think also I've heard that sensitivity to light or sound can be a symptom of hydrogen sulfide potentially. So those are kind of the ones that come to my mind, at least, that I've heard talked about the most.
Yeah, I think that's typically the presentation I've heard too, and sort of tracked. I think with hydrogen sulfide, it's more of like a Goldilocks, which a lot of things are. Like, it's not that hydrogen sulfide gas can't be helpful in the right quantities. It's, again, if there is an overgrowth or things,
normal part of your microbiome.
Right, if things get overgrown. And in some ways, too, hydrogen sulfide can help balance out certain, like hydrogen sulfide producers can help prevent methane overgrowth in a way, like if they're balanced out. So it's not necessarily that gas is bad, but when your cup starts overflowing with hydrogen sulfide, that's when it becomes almost like pretty toxic to the body in general. And there is those systemic type symptoms even outside of the gut that can be problematic for people. So I agree that that's typically what I'm looking for these days. Sometimes too, I'll make a note if people are reactive to like either higher sulfur supplements or higher sulfur foods. But, that's not the only thing I'd look out for either, because maybe they just have a deficiency in certain nutrients that detox sulfur. Which again, like if you had hydrogen sulfide SIBO too, you might be depleted in those nutrients that are needed to detox sulfur because your body's just overwhelmed trying to get rid of it. So you might doing things like thiamine and molybdenum and things like that can help with sulfur detoxification might be helpful, but it's not the only thing, but it can be a potential factor that might pique my interest to look into hydrogen sulfide situation if you are reactive to, glutathione, NAC, those types of supplements.
And that's a valid point too, is like a lot of what we're talking about is a high quantity of this hydrogen sulfide gas, which is just two hydrogens and a sulfur slapped together. That's all it is. We're talking about this in the gut predominantly, but there is this whole other separate issue of like, I guess you could think of it as how your microbiome processes sulfur versus how you and your machinery process sulfur. Yeah. So there are those people, and it's the CBS SNP that you're talking about, where some people will take in a lot of sulfur-containing supplements like NAC or glutathione or alpha-lipoic acid, and then it basically, like with the CBS SNPs, usually that enzyme is too fast. Like it's actually ultra efficient. And then you get a lot of these intermediates, and then that puts a great deal of stress on another enzyme that's typically much slower called SUOX. And that's where you need molybdenum, and you need like vitamin B6, and you need the nutrients to keep those enzymes going. Because if you're all of a sudden chucking a whole bunch of sulfur intermediates down at this poor little SUOX enzyme, you're overwhelming that system. But I know another symptom that I usually ask patients about, and I think about it more with relationship to the genetic SNP as opposed to the gut, is intolerance to sulfa drugs.
Yeah. Yeah.
If people have had back trim or I can't think of the ones, but like if you've tried a sulfa antibiotic for like a UTI, for example, and it made you really, really sick. Like I know my mom took one of those for, I forget what reason. She thought she was having a heart attack. Like she got very severe like chest pain and tightness of her chest, and she was home alone. And she thought like, oh my God, this is how I'm going to die. And luckily it did. Luckily it subsided. But it was very intense pain. And I happened to know, because I did 23andMe on my mom and myself years ago, she has the CBS upregulated SNP. So I think that her body just took in that sulfa drug and again, like processed it really fast, and it went and it put a lot of stress on that SUOX enzyme. And then she had all of these inflammatory intermediates that stressed out her system. But yeah, I think for hydrogen sulfide in the gut, though, another one I forgot to mention is like really toxic farts.
Oh yeah.
Bowel movements.
Sulfur smelling farts.
Sulfury farts or bowel movements is a dead giveaway that you have some sort of hydrogen sulfide overgrowth. Whether it's in the small bowel, the colon, or both is up for grabs.
Right.
But I would tend to think hydrogen sulfide dysbiosis if that were the case as well.
Right. And sometimes it's not that obvious, but yeah, when it's there, it's like, oh, that's for sure sulfur. Yeah. You got those toxic farts. That's 100%.
If you can clear a room.
Right. That's the best indicator. Yeah, and I think like the really interesting thing for me about hydrogen sulfide is generally the difference in treatment options, or at least what I've seen, tends to be surrounding the diet piece of the equation. I've heard a lot of practitioners, which I agree with, that people don't do necessarily as well going. And I think this is across the board, but I've actually seen practitioners talk about it in the hydrogen sulfide scenario, is that people don't do as well going high fat, low carb with hydrogen sulfide.
Yeah.
That tends to, usually again, you're going to be lower in fiber.
Yep.
And that could breed more hydrogen sulfide issues. And even like low FODMAP, like popular diets that are restricting fermentable fibers, have been shown to raise bilophilia, Wadsworthia, that bug, you know, the sulfur producing bug. So low FODMAP's been shown to increase that bug and lower your bifidobacteria. So again, could some of these diets be creating some hydrogen sulfide issues? Makes me a little bit nervous thinking about people that have been down this SIBO rabbit hole for so long, and they keep getting tested. Like, could potentially their SIBO being low FODMAP, being restrictive for so long, morph into a hydrogen sulfide issue?
I definitely think so.
Right. Like,
I bet that's pretty common, actually.
Yeah, I certainly have suspected that for a while. Again, if you're just depleting your microbes and creating a very hydrogen sulfide friendly environment, it's sad to think about, but I do think that unfortunately that could keep someone in like the SIBO realm longer, of like, oh, I still have SIBO, I have this hydrogen sulfide.
And then you feel stuck like this impossible case who's going to have SIBO for the rest of your life.
Right. But yeah, I mean, I think what I've heard from certain other practitioners in the SIBO space is that they don't recommend high or like high fat, higher protein diets with sulfur, which makes sense from a sulfur end of things. Like, again, but I also think that it's not just about it being fat and protein that's presented. It's more about that the fiber is not sufficient to balance some of these bugs out. So it'll be interesting, like you said, to see how prevalent this stuff is and to get more data points on it. But I just worry there is some data that insufficiency of fermentable fibers could lead to higher sulfide producers. And then it's like, are the popular protocols just creating hydrogen sulfide is my question.
I really think so.
Yeah.
And even, like, I think the study that you're referring to, I actually had pulled it up to make sure we talked about it. To be clear, I actually have not read this study yet, but it was on a slide in one of Lucy Mailing's courses. And it said right on here, a low FODMAP diet increases sulfide-reducing bacteria despite addition of prebiotic even.
Yeah.
And what the slide says is a randomized control trial of 37 healthy adults who consumed a low FODMAP diet for a week, supplemented with either maltodextrin or oligofructose. So starch, like a placebo, or a FODMAP-based prebiotic, basically oligofructose. And then significant increases in the abundance of both disulfovibrio and bilophila from baseline resulted from that. So it's like, good luck. You think that you're doing the right thing. I don't sound that, that sounded bitchy, but like, here we have practitioners who are well-intentioned, and we have people who are trying to fix their gut, well-intentioned, and they do low FODMAP or they do some low fiber diet, and they're just, it's like the gut is this giant spider web, and we're trying to pull on one of the threads, and we're kind of pretending like the rest of the web isn't going to shift when we do that.
Yeah.
Like, of course, there's going to be a lot of unexpected consequences, but I think couplefold to think about with hydrogen sulfide especially is that these bugs that we don't want to be overgrown are probably in balance with a lot of other microbes. And if we, maybe there's a huge link between bifidobacteria suppressing the sulfate reducing bacteria. Maybe that's like the link, but there's going to be some balance between quote unquote good microbes versus quote unquote bad ones. And we're kind of lumping them into the bad guys now. There's also that element of like a cross-feeding relationship where like maybe a compound that is maybe butyrate suppresses the production of hydrogen sulfide, and you're tanking your butyrate producers being on a low fiber diet or a low FODMAP diet. Maybe that's like, whether it's cross-feeding or something else, I don't know, but it seems like when you deplete the good bacteria, you are allowing more room for those potential bad guys to grow. They're not stupid. They're going to take up the space if they see the opportunity.
Right.
And then with the fat, it's interesting because I see keto becoming so popular, and I'm not anti-keto, but I think that it's done incorrectly 9 times out of 10. And people just like are pounding down blocks and blocks of cheese and fat bombs and way overdoing it, especially on like dairy. And that's something that will feed these sulfate reducing bacteria, particularly bilophila, because a lot of that comes from the bile. Bilophila likes bile. And if you're eating a ton of fat, you're producing a ton of bile to try to digest that fat. So whether you realize it or not, it might not be the fat itself in your diet feeding these guys. It might be the fact that your body is producing bile to digest all of this copious amount of fat that you're throwing in. And then it's the bile that's mucking stuff up. But ultimately, maybe there's a lot of people out there who should not be doing a super high fat diet. And it's not something that is in line with where their microbiome is at right now.
Yeah, no, I wholeheartedly agree. I think that, what you're saying about keto is totally accurate. And I feel as though there's so much focus when you're on keto because it's very hard to just make sure you're low fat and not going too high. Like the focus is, yeah, that's what I mean. Low carb.
Yeah.
So like the focus is so hard on just being high fat, low carb, nothing else matters. So rarely are they like, I mean, and then it's hard to incorporate fibers too, like in the mix. Mm-hmm. But like even some of the like lower carb fibers, I feel like they're not necessarily paying as much of attention to, because just being low carb is going to be the end all be all.
Yeah, well, carbs are evil, so.
Right.
Obviously.
Right. So, exactly, you're right. But yeah, I mean, I wonder if that's a slightly different study that you brought up too. Is that the one where they did the prebiotic group just by itself?
Yeah. Yeah,
okay.
It looks like, hold on, it looks like it was a 2018 study.
Okay.
In PLOS ONE. I'll send you.
Yeah, because the one, I will make another point too. The study I'm thinking of, they had people do low FODMAP group, and then a prebiotic group separate. Mm-hmm. I can't remember if they had a prebiotic in the low FODMAP arm. That's what's confusing me. But the one that I remember, it was very interesting how the low FODMAP did reduce symptoms. So they did find, okay, if you do low FODMAP, it's going to reduce your symptoms. Mm-hmm. But then right after that low FODMAP group started eating FODMAPs again, their symptoms came back almost immediately because they were following people after the study. But the prebiotic group had maintained symptom reduction. So they stopped the prebiotic that they did, and they still had lower symptoms.
Huh.
And there was an opposing effect on the microbiomes. Like, obviously, if you're taking a prebiotic, you have bifido increasing.
Yeah.
And then again, in the low FODMAP group, you have bifido decreasing. Mm-hmm. But it's so interesting to me that there wasn't it's so clear in the study that there wasn't a sustained benefit of doing low FODMAP, but there was more of a sustained benefit of doing a prebiotic.
It makes sense to me. Like,
yeah.
You know, it's not about obliterating and starving stuff.
Right.
The microbes are smarter than us.
Right.
They will find food. They will find a way to survive. That's what they're built for. But if we can just try to push and pull on the ecosystem enough that we rebalance it, then that's where the real change comes.
Right.
And that hopefully your body has like the enzymes and the machinery to keep those changes in place after you remove the stimuli.
Right.
Yeah, it's complicated. That should be the name of our whole podcast. IBS : it's complicated. That should just be the new name. But
I'm just thinking of that Meryl Streep movie. It's complicated. It's called It's Complicated with Alec Baldwin, maybe?
Oh, that would probably be good. I don't think I've seen it.
Okay. I'm thinking of that. When you said that it's complicated, it just like flashed in my mind. I had a weird moment. But yeah, I think that thinking that we can outsmart the complexity of what's going on in the gut is just not a good. There has to be at some point, and I think preferably from the get-go, but most of the time we have to coach people into thinking this way, or seeing it this way, I should say, that you have to foster the microbiome and nurture it. And I think there's not necessarily a very nurturing attitude most of the time in the SIBO space. Not typically. Yeah. When you think that you can just target that one bug and there's no collateral damage from anything that you're doing, step back and maybe think a little bit about nurturing, how you could nurture and foster if you've been down that road, and it usually isn't helpful long term.
Well, and I'll throw this out there too. Let's take a hot minute to talk about the idea of a low sulfur diet for hydrogen sulfide, because that I think is just a nightmare waiting to happen for most people. Now, again, like sometimes I do bring this up, but honestly, the population that I find myself recommending sulfur reduction for a few weeks and actually seeing benefit?
Who?
Not my SIBO patients. My colitis patients.
Not
always, but moderately frequently. my patients with colitis have pretty wicked hydrogen sulfide producer-based dysbiosis, and just doing a temporary reduction for a couple of weeks can help pull them out of their acute flare, and then we can start building up the prebiotics and building up the fibers. But honestly, like, I think this is more of a conversation nutritionally to be had with that camp as opposed to the SIBO people. But
yeah,
I get really nervous when I hear people talk about reducing sulfur in the diet because you need it.
Right.
Like, sulfur is really important for the mucus in your gut. And if you want to have an intestinal lining that can do its job, and you want to have some separation between you and your bugs, and you don't want a boatload of inflammation, and you want to be able to have like a mucus lining between you and your stomach acid, and you don't want wicked acid reflux, sulfur is one of the backbones of the mucus in your GI tract. So you're not going to starve the hydrogen sulfide producers because they probably are just going to gobble up your mucus if you starve them for long enough. Yeah. First of all, they have a wonderful buffet of sulfur waiting for them. Number two, your ability to produce mucus is probably going to be compromised after a while after doing that. And then that's going to lead to more leaky gut, more dysbiosis, more risk of infections or pathogens taking hold, and more inflammation and awful stuff happening. But also, like, you need sulfur for, like hair, skin, nails, everything.
Yeah, detoxification. Like
the structure of your body, detoxification, glutathione. Like, the biggest antioxidant in your entire body is made out of sulfur. And if you deplete sulfur in your diet for more than like a couple of weeks, you're going to run the risk of being really, really deficient in glutathione. Right. And then that's going to get you more inflammation and more dysmotility and more leaky gut. And then it's like you're off to the races again with a whole new problem. I think, and this is something too that I thought Lucy Mailing did well in her course about hydrogen sulfide. And I want to fangirl it up for her for a minute, but I remember she made a point of differentiating between bacteria like Bilophila that seem to really like the saturated fat in like dairy, for example, and that bile kind of component, and also like red meat to some extent being fairly high in sulfur. So if anything, probably if you're looking to reduce sulfur for at least a short period of time, you'd be best off to cut back on your consumption of dairy first and foremost. Number two, maybe consider reducing red meat intake. Like beef and lamb tend to be the two high ones. But whenever I hear people saying like, oh, I'm on a low sulfur diet, so I can't eat broccoli, or I can't eat, onion or garlic, or I don't even know, cauliflower, I'm like, just it's a drop in the bucket, right? Compared to dairy and red meat. So honestly, like, eat the vegetables, eat the fruit, eat the grains, like eat whatever else. But if you're really looking to reduce sulfur intake for, again, a short period of time, like a week or two or three, dairy's going to be your number one. Red meat probably is your number two. But I don't know. Have you noticed anything? Like, have you had any patients who have undergone reducing sulfur in their diet? And if so, was that like under your direction, or did people come in to see you like, okay, I can't eat sulfur?
Yeah, it's a great question. And I'm always apprehensive too, because of all the ramifications of being low sulfur for a long period of time. There's a few people, again, that come to mind when I think of doing some lower sulfur interventions. Like, again, typically I hear what you're saying, where it's, oh, I have a problem with the cruciferous vegetables. I must have hydrogen sulfide SIBO. I need to eliminate and starve the hydrogen sulfide SIBO. I've had a few people go on it temporarily just to see if it helps symptoms at all. Mm-hmm. If it doesn't help symptoms, I'm usually like, okay, let's kind of add these foods back in. And it's not necessarily helping at all. That's usually the case. Like, I rarely see excluding sulfur-rich foods make a ton of a difference. Yeah. That's kind of my limited. I'm typically not aiming at that anyway. Usually I'm focused on adding stuff in as much as possible versus removal. And I do think that there could certainly be some people that might benefit from going a little bit lower sulfur. I haven't necessarily seen it reap a ton of fruit symptomatically from the people that I've worked with. I haven't worked with anyone with colitis and low sulfur. Like, I can't think of anyone. Yeah. So it's interesting you say that. But I would imagine, again, like if you had sulfur overload, doing it for like a couple weeks just to calm things down might make sense. But it's the same thing. It's kind of similar how I think of low FODMAP. Going low FODMAP for a short period of time could potentially have some benefits for you. Yeah. Could reduce symptoms, like just calm things down a little bit. But it's not something I'd recommend going on and on and on and on. No. So that's typically how I think of low sulfur. I think of it in the same vein as, sulfur is super important. We don't want you to be low sulfur, just like FODMAPs are super important. Yeah. We don't want you to be low FODMAP forever. So it's a bit of a balancing act between symptom management and maybe working on the environment so that symptoms are a little bit better. Yeah. Because again, removing the FODMAPs aren't going to fix anything. Yeah. And same thing with removing the sulfur. Could reduce some symptoms, maybe take some of the sulfur overload, but it's not going to repair a hydrogen sulfide overgrowth. Yeah.
And I mean, I think that there might be some people out there who have hydrogen sulfide overgrowth because of overdoing it on high fat or sulfur rich foods. Like, again, right. I'm kind of thinking, like, I had a patient, she had been doing keto on and off for years, but it was the sort of thing where, like, she would be super, super on the wagon. Right. Or on the horse, whatever the expression is, for, days or weeks, typically. And then she would fall off the wagon, but like really aggressively. So, but she would still try to like be keto to the best of her ability. So like she would eat, actual bona fide junk food. And this, this dovetails into our previous conversation we had with Elena about like binging and this behavior where like you bring the pendulum way over here and you're way too strict. And the body's natural response is to swing the pendulum the other way and want you to eat all the cake or all the Twinkies or whatever. And like, you need to find a way to get more in the middle of that pendulum so that you're not violently swinging back and forth all the time. But like with this woman, she would be like super strict keto and she would eat like a pound or two of cheese every day.
I'm trying to like wrap my head on how much that would be.
Yeah. But then
that would be like, when you buy a pound of beef, like I think of that amount in cheese. Whoa, yeah. And it's like, so like that might be a good example of like, again, people, I stand by this. I think people do keto incorrectly 99% of the time. Yeah. There are some people out there like Dave Asprey and Mike Mutzel who promote a much more balanced, fiber-rich version of keto, which I think is great. But most people who say that they do keto end up just overdoing it on dairy, overdoing it on the fat, and really not getting enough fiber. But this was an example where like she would be keto and way overconsume dairy and do a lot of like heavy fat, heavy saturated fat eating. And then she would kind of swing back to like standard American way of eating for a period of time. And then she would swing back over here to keto. And, that was another study I remember that Lucy Mailing shared in her course was that simple sugar can feed the hydrogen sulfide producers. Yeah. Now, it doesn't mean that sugar is evil. It doesn't mean that you have to give up sugar for the rest of your life. But if you are having this behavior of like, really binging and overdoing it on the regular, or if you're eating like, I mean, how I ate growing up, like a Pop-Tart for breakfast and like mozzarella sticks for lunch. And I can't believe you were a Pop-Tart girl. I was a Pop-Tart girl.
Toaster strudels were where it's at. Let's face it.
I like toaster strudel. Did you use 2 of the icings?
No, see, I don't have siblings, so if I use 2 icings, I was only robbing my future self.
Okay.
You can pull that shit when you have siblings, because then it's like, oh, Judy won't have icing now. Ha ha ha.
I feel like then we just waste the ones. Like there'd be like 2 in there with no icing. No one's gonna play with that.
That's a shame. No. I actually had to meter it out because I knew I was just robbing myself of icing in the future if I did that.
What about like a Pop-Tart? What was your favorite Pop-Tart flavor?
I don't remember now. I think that there's like a s'mores flavor. I think there was a s'mores flavor that I was into.
There was.
But toaster strudels were where it was really at. Like, if my mom really wanted me to eat breakfast, and that was a process all throughout my adolescence, like, the toaster strudel was usually the best way to get me to eat breakfast.
Nice.
And now I look back and I'm like, oh, actual sugar and sugar and sugar. But the point being, like, if you have eaten a standard American diet, which is high in both saturated fat and dairy, and it's high in sugar, and low in fiber, like, that's kind of the trifecta for hydrogen sulfide overgrowth. Again, whether it's in the small bowel or the colon or both is anybody's guess. But that's kind of bad stuff waiting to happen. Or if you're doing keto and you're way overdoing it on saturated fat, I've got news for you. It's the saturated fat that really, really seems to feed the hydrogen sulfide producers. So, I think ultimately you want to get fiber on board and you want to get the diversity up so that you feed the other good guys and then they can suppress these would-be bad guys. Before we get into our treatment strategies, though, or our favorite tips and tricks, there's another bit that I had saved from Lucy Mailing's course where she shared a 2017 article where I'm just going to like say this goes flying in the face of what people sometimes will think of for a low sulfur diet. A randomized crossover study, 10 healthy adults fed a high and low brassica diet for 2 weeks. And brassica consumption was associated with a relative decrease in sulfite reducing bacteria and an increase in butyrate. So eat the freaking broccoli.
Oh, yes.
Eat the Brussels sprouts, eat the brassica vegetables, and like don't worry about whether or not they have sulfur because they're going to reduce the hydrogen sulfide producers anyway. Just don't overdo it on the dairy and the sugar and the red meat, and you're probably going to be fine.
Yeah. I like that.
Yeah.
Wow.
I thought that was pretty clutch.
Yeah, that came in the clutch right when we needed it.
Yep. So I do enjoy moments like that, taking a course or reading an article where it reaffirms something I already knew. And I'm like, I'm so smart. You go, Nikki.
Yes. I feel like a lot of the prebiotic studies are kind of like that. And because we're just dealing with low FODMAP all the time, seeing like some prebiotic studies come through with like reducing symptoms, like all the stuff that we can kind of see.
Yeah.
And there's certainly cases where prebiotics don't do that, but everyone's individual. Yeah. But, it's nice to see studies that reaffirm these things that we see on a daily basis. But why don't you tell me a little bit about your go-tos and then I'll jump in with anything.
Ooh, okay.
Yeah.
So getting diversity and fiber up is probably number one. Not overdoing it on those foods that we already rattled off. Supplement-wise, I have 3 favorites. And I'll say this too, like, this is something that I feel like I'm going to go into like herbalist mode in a minute, but bear with me anyway. First, my 3 actual favorites tend to be some sort of like GOS supplement, whether it's something like Bimuno or Galactomune, some sort of supplement with GOS. Typically is one of my number ones. PHGG is another favorite for this. And I do rather like the emulsified oregano tablets called ADP from Biotics Research. I don't use as high of a dose as some SIBO experts, namely the SIBO queen, quote unquote, Alison Seebecker. When I've seen her hydrogen sulfide protocol, I think she recommends like 5 tablets of ADP 3 times a day for the first few days. And then she drops it down to like 3 tablets of ADP for 3 times a day for like the duration of a month or so. That's way intense. Usually when I'm using ADP, I'll use like 1 or 2 tablets 3 times a day. Like getting people up to 2-3 times a day if it's like a really bad case. And maybe more often than not, I'm sticking with 1 tablet 3 times a day for most people. So in my opinion, you're just asking for trouble. You're going to do a lot of collateral damage with those doses. And frankly, it's not necessary if you do the nutritional stuff and if you add in those 2 prebiotics usually. But I do like ADP. I do think it's useful. What's interesting, and I'm going to throw shade on one of my favorite people in this space. So have you followed Jason Haverlek at all, the probiotic advisor, or have you taken any of his courses ever?
I have not taken his courses, but I've followed him. I've heard him on a few podcasts too.
Yeah, he's great. I really, really like him. But I'm still so mad at him a little bit because I kid you not, like a year and a half ago, maybe 2 years ago now, I don't even know, he wrote an article on his blog and he shared it on the internet that Codonopsis root, Dangshen, might be useful in inhibiting hydrogen sulfide producers. And I kid you not, the moment he posted that, all of my sources for Codonopsis dried up. Like, I'm having such a hard time sourcing that herb in like decent enough quality. And I swear it, ever since he wrote that article, I was like, darn it. And I don't think you usually need to do that for hydrogen sulfide, which is peculiar. But I really like Codonopsis more as like an immune regulatory herb and like kind of immune, I would say immune boosting, but not overly stimulating. And I like it for like, it kind of a little bit demulcent, a little bit moistening. But it's a lovely immune tonic. And I was using it quite a lot for that purpose. But then all of the sources dried up, and now all I can find is these like whizzly old nasty roots.
Oh no!
From like some, back alley herbal supplier. So I'm kind of waiting for my normal sources to get it back. But I swear they haven't had it in like 2 years ever since this article came out. I was just like, darn it. So that's depressing. And I think Lucy Mailing mentioned that in her course, that herb. And then I think she shared a study that Korean ginseng might be useful. And I was like,
cool.
No. Like, Korean ginseng is already crazy expensive and very hard to harvest. And I just worry, like, the kind of like environmental nerd in me worries that people are going to over-harvest ginseng and Codonopsis and deplete resources of those herbs because people are just like Googling or hearing a podcast like ours or seeing a post from somebody they follow. They're like, oh, now I need Codonopsis and Korean ginseng. And I'm like, no. So please don't buy those things. People like they have other value to them beyond H2S. And honestly, I've never had to use either of those for a hydrogen sulfide case before. And I've done pretty well with it so far. But yeah, so ADP, emulsified oregano, PHGG, and GOS are my 3, personally. Another one I've seen is pomegranate peel or pomegranate husk. Powdered can be useful. That's another Jason Haverlek thing. And I have seen that be helpful for some patients too. But I don't use it for everybody because it tastes nasty. So.
Nice. Yeah, I think you're right on with the theme of what I think most of the research is supporting, that like you have to feed the bugs. I think especially in hydrogen sulfide cases too, because we know that it grows, like what you were saying, in an environment that's higher saturated fat, higher sugar, and I'm missing one too. We were saying maybe sulfur, like higher sulfur foods, kind of within that mix. But yeah, I mean, we have good evidence to support that. And I think, the way we view SIBO more recently, and I think we've connected on this, is like, there's a small intestinal dysbiosis piece that's so huge. And I think we get so hyper-focused on this idea that our small intestines is like teeming with bacteria, like that need to be killed, versus like this idea that there's an imbalance. Yeah. And but I agree with you. I think some of the prebiotic approaches can be very valuable for a hydrogen sulfide producer. for sure, building up diversity in the diet, building FODMAPs back in can be so huge. I think you want to be a little bit careful with the fat protein intake, which, again, similar to what you were saying before with taking out the saturated fat, taking out the red meat that are higher sulfur.
Or just don't overdo it.
Right, exactly.
Like, I'm not anti-red meat, but like, it kind of reminds me, like, remember back when paleo was starting to really gain a lot of traction, and the whole shtick with paleo felt like, and I will say I was more on that bandwagon for a while, and I still like paleo as a template for a lot of things. And a lot of the recipes that I cook at home end up being paleo. Yeah. But then, like, we'll have rice or something else too that's not paleo. But like, remember back then, it was like, kind of like the sales shtick for paleo was, hey, come over to our side. You could eat all the steak and bacon you want, baby. Yeah. And it was very much like, come over here, we have bacon.
And, and then, and to your point too, sorry, I didn't mean to cut you off. Like, no, you're good. People were okay with eating a plate full of bacon, but we're scared to eat a half of a banana.
Yes!
Like, it's that mindset.
Or a cup of rice.
Right. Like, come on. So yeah. I agree. I mean, I think what I find so often, that's usually like the people that are coming to me, like they're a little bit too low carb, and so we work on just the fact getting carbs up usually builds the fiber back in. If you're using whole food to get you to your carb needs or whatever, that's usually going to add some fiber in, add some things in, and replace maybe some of the saturated fat that you were having instead of having the carbs. So if you were coming from more of a paleo template, that's typically, I would say, not always, but typically a little slightly low carb. Yeah. Adding in a little bit more carbs into the mix might offset some of the calories that you would get that'd be higher in saturated fats. Yeah.
Well, and that's the thing is, like, with my patient who is eating a pound or two of cheese every day. Right. It's like, what is that a symptom of? It's a symptom that she's restricting in so many other ways, and she's not allowing herself to have any carbs, any sugar, anything. And it's like, if that person loosened up the reins a bit and gave herself permission to enjoy her food a bit, and, maybe don't go to the Cheesecake Factory and pound down a giant thing of cheesecake every day. And don't start all of your mornings with Pop-Tarts and toaster strudels necessarily. But maybe give yourself that permission to have a little bit of sugar, heaven forbid. Right. Or a little bit of, like some rice or quinoa or like a piece of toast. Like, maybe you can allow yourself to have some carbs and some like root vegetables that have carbs. And it's like, if you are less restricted in those other ways, then you probably won't feel the need to eat 2 pounds of cheese.
Right. Like 100%. Like, that's one of the few options in the template that you're using to fill your calorie need. So it makes sense that she's getting a block of cheese, and maybe broadening out the diet a bit and not having these arbitrary rules can help you feed your body better. And I will say too, like, giving you the authority to listen to what your body's telling you, I think, so huge in those scenarios, because I think a lot of the times when you add in, this weekend I had some cookies, when I had some cookies, I felt totally fine. If I did that every single day, I could potentially notice an effect. So it's all about listening into how your body's responding to different things versus just trying to meet this arbitrary list of yes and no foods that might not even be relevant to your particular case. Yeah.
Well, and even like what we talked about a couple episodes ago in the food reintro episode, when you're approaching nutrition from this binary legal, illegal.
Right.
Green, red, yes, no. When you have that sort of dichotomy and there's absolutely no gray zone whatsoever, then it can lead to these kind of like logical whoopsies. Like once we got talking about it, I think she realized like, oh yeah, that's not really healthy to eat a pound or two of cheese every day, right? And I was like, yeah, it's not so good. But like when you get caught up in yes, no, is it legal? Is it okay? Yes or no? Is it on this list? Then it kind of, I think that style of nutrition anyway, like it takes away your autonomy and your control and your decision making. And it's like, oh, I just have to follow the Whole30 and I have to follow it exactly and stick with the yes and no foods.
Right.
Or keto, like legal and illegal, whatever it might be, the lingo. So I think that's a piece of it. But it can kind of, you can have these moments where like you come back out of it and you're like, oh,
right.
Oh, yeah, why was I doing that? Huh.
Right.
Like, you know, and this particular woman, like, she's very smart. She's a nurse.
Right.
Like, she's very smart. She knows better, but it's like when you get kind of caught up in, you know, like listening to certain influencers who say that keto is the only way for humans to eat. End of story. Everybody needs to do keto. Or, you know, everybody needs to do coffee enemas. Or everybody needs to take this. It's like, well, but whenever I hear the words everybody needs to, I'm just like, no. Automatically, I'm taking what you're saying with a huge grain of salt.
Right. Well, and I think that most of the time, if you're relying on a diet like that with the good yes and no, you're inherently not trusting yourself.
Yeah.
And, you know, I think it takes some time and some coaching a lot of times to get that trust back.
Yeah.
And it's not necessarily an overnight thing, but there's light bulb moments when you work with people like, so you're eating low FODMAP, but you're 900 calories below your where you need to be. So like, let's broaden this up somehow. Like you've stacked all these diets in here, but you're not well nourished. And that makes sense, but it's just not something, it's not sexy. It's not discussed.
No.
Really. I mean, being in our world, like we talked about in the previous episode, it's like we hear all day long that calories are important. Like everything low calories, awesome. So they might know like, oh, I'm not overeating, so I'm good. But, you know, if you're not nourished, it's going to have huge effects on gut function. So, yeah, it's a wild, it gets to be a wild west.
It is. And I'm excited because, like, I think, you know, and again, hydrogen sulfide is a great example of this, but there's others too. Like, we know so much about the gut microbiome, and I'm so grateful to be practicing in this day and age when we know so much. But also, I'm very, very aware that what we will know about the gut microbiome in 10 years or 20 years or 30 years is going to blow our freaking socks off. Right. And we're going to look back and we're going to be like, oh, in 2020, we thought that. Oh, I can't believe we thought that in 2021. Like, it's going to be crazy to us. So I'm well aware that we're on this kind of like roller coaster ride of learning a lot more stuff. And again, like with the hydrogen sulfide, all right, I think this is just like one of those blips on the roller coaster of like, all right, now we have this test. I think it's going to get way overdiagnosed. It's going to get blown out of proportion for a couple, 5 years maybe.
It'll correct itself.
Yeah, it'll kind of correct itself. The pendulum will swing a little bit more. Some other gas will be discovered. Some other bacteria will be discovered. And then we'll all focus on that thing only for another 5 years. So it's not the end of the world. But I think just know that science is not done yet.
Right.
And there's a lot of things that we humans have yet to fully parse out about the human body and the gut and the microbiome and microbes in general. So just always kind of have that little piece of your brain that's willing to say, we don't know it all. I don't know it all. My practitioner doesn't know it all.
Right.
That internet guru doesn't know it all. Because they can't know it all. Because there's literally, like, they're doing research still. on a lot of these topics.
Right. Like, we're constantly going to be learning and adapting. And if we weren't, like, there'd be problems with that. If we were just kind of continuing on, if we said this is set in stone for our hydrogen sulfide producers, this is exactly what we're going to do here on out forever and ever and ever. And then new research came out and we were like, no, this is actually the right way. Sorry. It's my way or the highway. That's not what you would want, because I don't know. I think it's a really valid point. You want to make sure that you understand this is an evolving field, and we're all just trying to learn and make the best decisions based on current evidence and our own, like, I think sometimes even our own, like, intuition, gut feelings. I know, like, we can pair it, but we're working with people too, and we can get we can read people in ways when you work with them that, you know, like we were saying about some people are totally unaware of their stress. But talking to them, you go, oh, no, you're stressed. Like, you're very much stressed. You're not necessarily aware of it, but, like, we can see it. So, I mean, there's so much even to learn about our clients over time that we work with. But you're totally right. It's a changing field, and we have to always be ready to adapt and continue to learn.
Yeah. Well, and I think that's one of the benefits of working with somebody too. Like, just having somebody to, like, check in with and have that accountability and know that there's somebody there for you if there's a bump in the road. But, like, I have a sticky note. I don't know if I've ever shown you this, but I have, like, a parade of sticky notes on my computer. And one of them that I need to be reminded of this is, it says, you can't see your eyeball with your own eye. Yeah. And that has a picture of an eyeball. But, like, no matter how smart you are, sometimes you just need another human being to either, like, see something that you can't see, acknowledge something that you don't want to acknowledge, or tell you to snap out of it and give you just a little, like, shake and a come to Jesus moment. And those are the ones that I have a hard time with. I've had a lot of scenarios with people where, like, I would like to shake them a little bit and say, snap out of it, you loon. Like, acknowledge your stress for once in your life. Or like, can't you see that this is what's happening? I'm not good at having those conversations yet. I think as I get older, maybe. But, just, like, seeing something that you can't see or acknowledging something that you don't want to acknowledge and having another person there to kind of help you with that can be really beneficial. And that every single human being needs advisors and needs medical practitioners. Like, you don't see surgeons doing their own surgery. You don't see OBGYNs doing their own pap smears. You don't, I think to some extent, like, I need to check in with people and, like, get acupuncture and, like, check in on my health. I have a primary care. I go see my primary care and get some blood work and such done every year or so. So I don't know. I don't know why I went on that tangent, but I thought it was worthwhile.
It's worthwhile. And I have learned about you that you want to shake some people.
Yes.
So we need to, like, get you a doll or something.
Maybe.
To shake some frustration out.
In the last 5 or so months, this will be a tangent, and then we'll wrap up for the day. Because I think I'm out of things to talk about with hydrogen sulfide. I've learned about something called the Enneagram, and I think I've told you about this a little bit, but it's like, this sounds really lame, but it's like a personality test. Yeah. But it's the one that I've taken in my life that actually, like, resonates with me so much more than any of the others. Like, I don't know if I'm, like, an IFQJ or whatever the other one is. And, like, I don't know any of my types as far as that goes. But, like, the Enneagram thing really has, like, I think I've got myself pretty pegged, and I pegged my daughter in a big way. But, like, the type that I am, I'm pretty sure, our thing is that we try to avoid conflict at all costs, and we want everybody around us to be happy. Yeah. And we will do whatever we can to, like, maintain the peace and keep people happy and harmonious. And a lot of times that boils down to, we take our own feelings and preferences and emotions and just, like, put a lid on it and shut it down. which is funny that, like, I've talked about that so many times with stress. But, like, oh, it would make most of the people in the group happy if we went out to get pizza, but I really don't feel like pizza. Oh, I'll just tough it out. I'll shut up. And we'll go get the pizza kind of a thing. But in everyday life, and they say that this type is out of tune with their anger. And, like, one of the healthy things could be is kind of like acknowledge when you're annoyed or acknowledge when you're feeling like icky feelings, because usually type 9s kind of like take those icky feelings and like anger especially and like resentment, that sort of stuff, and we'll just like shove it down. So gradually, as I become more aware of this, I'm acknowledging, no, there's some people who I would like to shake like a rag doll and just tell them, snap out of it!
We need to get you like in a boxing class, or like there's a place, it's actually like a part of an axe throwing place in my area where they can like lock you in a room with stuff that you can smash.
Oh, I think I've heard of something like that, yeah.
You need to go to like one of those rooms. I feel like you'd enjoy yourself.
Yeah, I don't know. I think there was a video I saw on YouTube about this Enneagram thing.
Yeah.
And it was each of the Enneagram types in therapy. And when it got to the type 9, the person was like, okay, so are there any like laws or rules that prevent you from telling other people what I tell you in this appointment? There is? Yeah, HIPAA? Okay. And then it's like cut to, and the person is like, and then they did this, and she can't watch my kid for 5 minutes without giving me shit. It's like, it was so funny because like the person was really composed and really cautious. Like, is there any way that you could like legally not tell anyone what's going to be said here? And then once the person learned, oh yeah, what you say here stays in these walls and nobody will ever find out, and then they're just like, ah! And I thought that was a perfect depiction. Like, yeah, I can see that.
Oh my gosh.
It was beautiful. It was one of my more beloved YouTube discoveries in the last couple weeks. I thought that was a pretty funny meme. But yeah, I'm working on it gradually. You know, I'll keep painting for the time being as my stress relief.
I want like your paintings to get like more angry.
I know, they are very
like sweet. I want to see it in your art. I want to see some anger in your art. That bottom one looks like there could be some anger in it.
Of course, you know who painted the bottom one, right?
Oh, it's Jess.
Yeah. Oh yes, my type 8 on the Enneagram child painted that one. And I petitioned her to keep it in the office. The type 8 on the Enneagram is very like, give zero shits, apologize to no one, it's my way or the highway, end of story, done. And yes, the type 8s are said to be quite in tune with their anger, and they express it and they scare the shit out of a lot of people because they're very like, in your face! Yeah. And that's my child.
Well, yeah. I'm waiting for like a similar one of some sort to show up on the wall. I'll be waiting for that. I'll be on the lookout.
I'll keep you posted. I don't know. I can't even fathom what I would paint that would even be halfway to
I think you just have to free paint it.
I don't know. I think
maybe just put some paint on your fists.
And just punch the canvas?
Yeah, punch the canvas. That's what I want to see on your wall. When I see that, although I don't know if canvas would work, you might punch right through it.
Yeah, I might punch right through it. I'll have to think about this. I'm not sure how this is going to work out, but I'll try to. Instead, maybe I will. I was thinking, have you ever noticed my little guy?
Oh my gosh, I've never noticed that.
I've secretly been hoping somebody would notice someday, but nobody ever has. So I'm going to just show all of you.
It blends in so well.
I know. His name is No Face.
Oh my gosh.
And he's on a little swing. I was thinking of adding a No Face painting to my wall next. Actually.
Oh yes, that would actually be great.
He's in one of my favorite movies. So for those of you who are watching on YouTube, if you can tell me the name of the movie, I don't know, you get like an imaginary brownie point with me if you know what movie he's from. So,
I know it. Because I
told you to watch it.
Yeah.
Yeah.
It's true.
Yeah.
Okay.
Yeah, so I have my little No Face. He's always swinging there, hanging out.
Aww. Love it.
All right, guys. Well, I don't know, Amy. Do you have any other nuggets to share about hydrogen sulfide other than there is hope?
Yes.
That's the
plenty
lovely
of,
thing
I actually
is
think
that
that there is like plenty of hope, especially from a diet, like just changing the dietary approach, I think could be huge.
huge. Yeah. I find hydrogen sulfide to not be that complicated to work with most of the time, which is weird because most of my patients who come in with hydrogen sulfide based problems have been told by other practitioners that this is like the absolute worst case. It's the worst version of SIBO, and it's really aggressive and hard to treat, and you're doomed. You're just always doomed. And it's like once we get a lot of these pieces of puzzle in place, and then maybe like address other stuff that's going on. Like if you have hydrogen sulfide overgrowth and you also are a man with low testosterone, like you need to treat that too. Yeah. Or if you are a woman with hydrogen sulfide overgrowth and you're also hypothyroid, you need to treat that too.
Right.
You're still going to treat the body holistically. But it's like once we kind of get these ducks in a row, it's not that hard to work with, honestly, from my experience. And that can either be verified with repeat breath testing or what we failed to mention was stool testing.
Yeah.
Really quickly. So there are stool tests that look at some of the hydrogen sulfide producers now. I know, let me think. So I use Thrive quite a bit. That's a 16S company. They will look at, I believe, both bilophila and disulfovibrio. But they like lump it in together in a funny way. So it usually only shows up as disulfovibrio. You actually have to plug it into another system to see bilophila usually, but they do have the ability to measure it apparently. There are tests like Somagen Gut Biome Plus. What I will say about that one though that's a little peculiar is they will typically identify bilophila and disulfovibrio, which is good. But I've actually seen cases where one or both of those are a little bit elevated. Like, not crazy. Like, it's the difference between, like, 0.3 and 0.4%.
Right.
But then you go up to the page where they talk about hydrogen sulfide production, and they label that as normal. So I think you have to verify and look at both.
Yeah.
I think that looking at the hydrogen sulfide production part of the Somagen test is great. But then also just take a peek on one of those last pages where they go through like the parade of organisms and look to see if you have bilophila or disulfovibrio elevated. I've seen that a handful of times. I don't know like where their threshold is for that. And then the other one that comes to my mind is Genova's GI Effects does measure disulfovibrio. It doesn't measure bilophila, to the best of my knowledge, but it will do disulfovibrio. And the GI map, last I knew, does not look at either of those bacteria.
Yeah, that's correct.
If you're looking for that, you'd probably be better off with Thrive or Somagen Gut Biome Plus. I did videos on my YouTube channel about that a couple months back and talked about each of those and how to go through the results and how to interpret the results for both of those. But yeah, I've seen numbers get a lot better on repeat stool testing after we get some of these ducks in a row, like we talked about.
Yeah, for sure. Yeah, I like the Somagen test. You turned me onto that one. I know BiomeFX looks at that as well.
Oh yeah.
That bilophila. I hate pronouncing that one. But that one is on the BiomeFX.
Yep.
I don't think I've ever seen disulfibrio, but they could measure it. I can't remember.
Yeah, I don't think that one's on there either. I remember when I got a BiomeFX done, I think I looked and there was no disulfovibrio, if I remember correctly.
Yeah. Cool.
Yep. Yeah, so pretty good overall. There's a couple of different ways that you can measure and try to assess these. Again, like keeping in mind that stool testing is going to be more reflective of what's hanging out in the colon, particularly the latter part of the colon. It's not necessarily, like if you have disulfovibrio overgrowth on a stool test, please don't go around telling people that you have hydrogen sulfide SIBO. That actually, I just posted a video last week actually about whether or not we could use stool testing to diagnose or monitor the progress of SIBO. Spoiler, the answer was no. But if you want to know why, and if you want to follow along with some research articles, why I base my opinion on, go check out that YouTube video on my channel, because I did just post that, I think, last week. But, I think that you can at least determine hydrogen sulfide colonic dysbiosis based on these stool tests. And then you can use the breath test to try to figure out if the location is in the small intestine too. But like I say, it's not super common from what I can see. I've only had maybe 1 or 2 people where I was like, yep, hydrogen sulfide SIBO, bam, there it is. And I've had a lot more people, like probably 20 people, where it looked more like hydrogen sulfide dysbiosis, but it didn't look like it was isolated to the small bowel. So, for what it's worth.
Yeah, for sure. My leg's going to sleep and Armand's mowing the grass, so now I'm distracted.
Nope, no worries. Well, that's a good place to wrap it up. So, guys, as always, if I could actually ask a new thing of you, oh dear listeners, normally I ask you to rate us 5 stars, like, comment, subscribe on YouTube, etc. Can you do us one better? And if you are a member of one of these IBS groups or SIBO groups or gut health groups, could you do us a big favor and share the podcast with those groups? Because those are the people who would benefit from this kind of information. So you could either link to our YouTube channel or just drop the name of the IBS Freedom Podcast. But if you can help us reach some more of the people who would greatly benefit from this information by just putting a quick plug in one of your Facebook groups, I know I would be absolutely forever grateful. I'm sure Amy would as well.
Forever grateful.
Absolutely. Hashtag forever grateful.
Yes.
We would deeply, deeply appreciate that if you would be so kind as to share the link to the IBS Freedom Podcast or just the name in one of your groups. So thank you in advance for those of you who could do that. And I think that's about a wrap. So we will see you in the next episode of the IBS Freedom Podcast. Until next time, my darling, I bid you adieu.